Hello everyone. In this video we are going to talk about IFT, that is interferential therapy. IFT is a medium frequency current. IFT जो है वो medium frequency current है. That means कि उसकी frequency जो है वो 1000 to 10,000 Hz के बीच में रहेगी. As it is a medium frequency current, it can deeply penetrate into the body tissue. Definition: it is a production of low frequency current in the body tissue by the simultaneous application of two different medium frequency current. दो medium frequency current है जिसका frequency different है. जब ये दोनों interfere करते हैं तो low frequency current produce होता है. The principle of IFT was first introduced by Hans Nemec. Hence, interferential current is also called as Nemec's current. Principles of IFT: two medium frequency current with slightly different frequency are applied in such a way that they cross each other and interact to produce a low frequency therapeutic current at a relevant point. Resultant amplitude of this new current is sum of individual current amplitude at any given point. Two peak amplitude in same direction coincide. Resultant amplitude is at maximum called constructive interference. Two peak amplitude in opposite direction coincide. There is cancellation of current called destructive interference. Resultant current varies in amplitude is called as amplitude modulated frequency or beat frequency or treatment frequency. If two medium frequency current remains constant, then beat frequency also remains constant. So current at constant frequency gradually diminish due to habituation of the tissue due to particular current. So to correct this, a continuous varying beat frequency is maintained is called frequency swing or frequency sweep. Methods: in that we are going to talk about bipolar, quadripolar with vector. Bipolar is for localized tissue. Here pre-modulated IFT are applied through two surface electrode, useful for smaller areas. Quadripolar is used for the deeper tissue. The four electrodes are positioned around the target treated area so that each channel runs perpendicular to the other and the current crosses at a midpoint. It is used to treat a flat surface. Quadripolar, in that there is static interference and dynamic interference. Here the area in which IFT is set up remains stationary. This area of static interference gives appearance of clover leaf. It lies to the 45-degree angle to the perpendicular lines from each electrode. Dynamic interference. The dynamic area of the interference is also called as vector sweep, vector skein, rotating vector, etc. It is obtained by varying the current intensity from 50 to 100%. This is moving the area of interference current in a to and fro manner through 45 degree. Quadripolar with vector scanning, used for deeper tissue with enlarged area. Parameters: frequency sweep pattern. It can be triangular, rectangular and trapezoidal. Triangular, in that frequency is not constant. Frequency continuously changes. For first 6 second frequency increases. For next 6 second frequency decreases. Recommended for acute cases. Rectangle, in that frequency remains at the base for 1 second then suddenly increases to the higher frequency for 1 second. This form of treatment has aggressive effect. Recommended for subacute and chronic problems. Trapezoidal, used for milder form of treatment. It is easily tolerated by the patient. Recommended for subacute and chronic problems. Duration of treatment is 10 to 30 minutes. Low intensity with short treatment time in acute cases. High intensity with long treatment time in chronic cases. High beat frequency used for analgesic effect. Low beat frequency used for muscle contraction. Types of electrode: metal electrode, carbon rubber electrode, suction cup electrode. Indication: pain relief, hematoma, chronic edema, contracture, musculotendinous disorder, asthma, migraine, muscle weakness. Contraindication: arterial disease, deep vein thrombosis, acute infection or dermatological condition, open wound, unreliable patient, hemorrhage and tumor. Dangers: in that burn and hematoma. Advantages: produce no sensory nerve irritation, free from burning sensation on skin surface, harmless, suitable for treating deeper layers of the tissue, cause low skin impedance. Impedance is equals to 1 upon 2 pi fc. Physiological effects. Physiological effect of IFT depend upon magnitude of current, rhythmic or constant mode of current, frequency, Accuracy of electrode positioning. Physiological effect is relief of muscular pain by activation of pain gate control mechanism, activation of nociceptive fibers, increased blood flow, removal of exudate, muscle contraction. Procedure. Before treatment, skin should be clean and clear. Wash the part of the body to be treated. Electrodes should be placed in such a way that they crosses the affected area. Suitable frequency given for different conditions. Select the sweep pattern. Triangular sweep. Stimulate one nerve at a time, used for acute cases. Rectangular sweep. Stimulate two nerves at a time, used for chronic cases. Trapezoidal sweep. Stimulate three nerves at a time, used for subacute cases. Select the base frequency and upper frequency. The difference between upper and base frequency gives the spectrum. Increases the intensity gently according to the patient tolerance. After the treatment, adjust the intensity control to minimum. Switch off the mains and disconnect the electrode.